Welcome back to another episode of The Loco Fit Show, where we redefine what healthy means to you. I'm your host, Laurin, and this week I am interviewing my friend Racquel Frisella. She has been on the podcast 2 times?
Yes.
2 or 3 times?
Yeah.
And we're actually in person today at your amazing office. So if you guys follow me on social, you've seen that I've posted some reels here, and just your place is amazing. I've been seeing you now for several years, but this facility is just absolutely incredible. So thank you for doing this.
Thank you so much for having me back on your podcast. I'm very honored and excited, and I just love everything you put out there. You're just an amazing person and an educator, and I'm very excited to be on your podcast again.
Putting me all in the feels right now. So we're actually, we're getting, if you're watching the video, we're getting IV drips right now, which is very needed, to be super honest. So
Multitasking.
The reason I'm actually in St. Louis is because I went to a concert last night with my friend Olivia, and I've just been traveling like nonstop lately, so I really am feeling pretty run down. So I'm excited that we're doing this, because I was like,
yes, this is perfect for you.
Fall asleep. I've actually never had an IV, so
really?
Let's explain this a little bit. I mean,
yeah,
like in a hospital, but like in a normal setting. So like, when would you get this? When would you recommend this?
We just started offering this within the last few weeks, but it's always something I wanted to do because it's something I found really beneficial for me. Just as like a preventative, I do not drink enough water. I'm really bad about that. I try to be better. As you see my big jug over there, I've been carrying it around, but I don't get very far. But
you're like, it's on my desk. That's step 1.
Yes, I'm trying. But IV like this is a vitamin booster. So it is obviously, we're using lactate bringer. So it's full of electrolytes. And then we added B12, B complex, vitamin C. And then for your girlfriend who is nauseous, we were able to add a little anti-nausea medicine in there. So this is just something so nice that we can offer for patients if they're here getting a facial or a treatment. And they just feel a little, like you said, if you've been traveling a lot, if you're run down, if you feel like you're on the verge of, your body's kind of breaking down, just that little bit of a vitamin boost can help with just overall health, hydration, immunity, sleep, a little bit of everything. So it's just a way to take care of yourself.
Yeah, and it's about 30 to 45 minutes.
Yeah,
right?
Yeah, this is a full bag, so about 30 minutes. Then we have smaller ones too if somebody's in a hurry, but it's just a good little vitamin boost.
Yeah, no, I'm super excited for this. Like I said, I've just been feeling very run down. And I know people will get these when they're like hungover, right?
Yes.
Or typically the way that I know them, they're either when somebody's hungover or after they've made weight for a powerlifting meet. So when you cut weight, people will cut, 15, 30 pounds. And if you're competing the next day, obviously you can rehydrate with fluids and your own electrolytes, but this is just like so much faster.
Totally. It just hits your body faster. I had one for the first time in a non-healthcare setting when I had the flu, and I just felt a complete turnaround in my body. And so it's always been something whenever I feel a little run down, I'm like, I need to get an IV. I know it's going to help perk me up. So
yeah, literally one of the only like hangover symptoms I really feel is from being dehydrated, right? I'll get a really bad headache. And you just like, when you're so in tune with your body,
yes,
when you're dehydrated. And I'm somebody who like really feels that. Like I immediately get a headache, feel super run down. And like I said, because of travel and also like living somewhere really hot, like we're in St. Louis right now, super hot here.
Yep.
Florida, it's always hot. So I'm always sweating. So
yes,
it's like, I'm excited for this.
Yeah, I'm so excited. We got to
back.
Give your first one.
So question about, I have a few questions lined up, just things that I've been wanting to ask you. So PRP for hair loss.
Yes.
First and foremost, let's talk about that. One of my coaches, Danielle, was actually asking about that in particular. So what does that like entail? What can people expect?
It's really popular. So PRP is platelet-rich plasma, and we can use it in a number of ways, but one of the ways is for hair stimulation, hair growth. And so when you come in, we would draw your blood, and we draw it into a special tube that there is an auger in the bottom. So when we spin the blood in our centrifuge, which is a machine, you put the vial in and it spins it super, super fast. It pulls the packed red blood cells to the bottom of that auger and leaves the platelet-rich plasma on top. So when it's all said and done, it comes out looking like this beautiful gold serum. We call it liquid gold. So it's packed with your own growth factors, and it's like very nutrient dense. So it's almost, I always tell patients, think of it like fertilizer that you put on your lawn. It is going to stimulate,
put on your hair,
repair, and growth. So then we go, if we're using it for hair growth, we will go in and inject it into the scalp. And it's going to just do essentially that, strengthen the hair follicle. So you do have to have hair there. If you are bald and there's truly no hair follicle, no hair shaft, it's not going to just create new hair. But what it will do is strengthen weakened or thinning hair. So if you're noticing, your hair is really thinning, if it's patchy, if it's not as thick as it once was, that's where it's going to go in, and that kind of feathery hair, it's going to really strengthen it up. And it can stimulate some new growth, but it's best, really with anything we do, prevention is key. So right when you start noticing the thinning, noticing the hair loss, it's great to jump on that stuff because we want to catch the hair before it's gone. We want to strengthen it up. So, with anything anti-aging or, proactive is best. So we want to try to be proactive rather than reactive. So if you're noticing thinning coming in and getting that process started early is going to be best. And then it is done in a series. So you're looking at like 3 to 4 treatments spaced about 4 to 6 weeks apart. And with each treatment, you're just going to see more and more improvement.
Do you have to do every 4 to 6 weeks, or like if you extend it, will it like not essentially work as well?
It's best to stay on a cycle so that because we want to catch the hair. Our hair grows in different cycles, so it's best to stay on track. However, if you get a little bit off, it's not a huge ordeal. Like if you're traveling or whatever, we can pick it back up. And usually people will do a series and they'll be super happy. And then at that point, I just tell them to go into kind of maintenance mode. So maybe that's 6 months, maybe that's a year, and just kind of come in every so often for a little booster treatment, and we can kind of stay on top of it.
Nice. So that would just be like all along the scalp, or really like is it more like where you need it, or?
It's going to vary patient to patient. Some, like if it's more of a receding hairline, sometimes we'll just kind of really focus on those areas. And if somebody just feels like they want general revitalization, we can space it across the entire scalp.
Okay. And is this like pregnancy friendly? Is this something that you need to do? Like, are there certain times where you can do it or not do it?
PRP is one of the things you can do while pregnant because it's your own.
Yeah.
So, that's something that's great. You can do it while you're pregnant. There's really no time you really can't do PRP because it is your own body. So
that's good. Well, she was asking, and I was like, you know what? That's a really good question.
Yeah,
and
it's super popular, and it works really well. And it's honestly one of the only things you can do.
Mm-hmm. Especially for hair loss. Hair loss is really devastating, and I don't really feel like there's a lot of good options.
Totally.
Right? Like.
Yeah, I mean, it can do a number on your self-esteem. So with anything we do, I mean, we just want to help people look and feel their best and feel like their most confident self. So taking care of yourself, it's truly, it floods into every area of your life. When you're feeling good about yourself, you're going to be happier, you're going to be a better partner, a better spouse, a better friend, a better worker, whatever it is. So even something as simple as doing a hair PRP treatment, it can change your life.
Oh, yeah. I mean, skincare, obviously, you guys do injectables, but also the skincare line. And I just got a facial here, which is, if you're watching, that's why my face is glowing and there's no makeup on this. But it really does make a difference. Like, how you present and how you feel affects everything else.
Yeah.
So that inner confidence doesn't matter necessarily what you look like, but it really does help just kind of put your best foot forward.
Totally.
Especially if you're like really, because we've all been through periods where our skin, we know how it feels when our skin looks really great and then when it looks not as great.
Yeah.
And I think that like the more that I've invested in skincare, I mean, it's completely life-changing. Like there's no going back, right?
Yes.
There's no like, oh, I'm not gonna, and we were joking about it. Like, doesn't matter how like late it is or how tired I am or whatever, I'm doing skincare. Like the other night we all went out and, we weren't out super late, but we were out in Nashville, drinking whatever. And we all get home, me, and my other friend Chanel, and we're all just taking over that. It was just so funny. So it was like, obviously we all care.
Yes.
But I was like, it doesn't matter if it's 5 a.m. I'm doing my skincare.
Yes. I saw that meme floating around for a while where they were saying, it's 2 a.m. You just got a call that your husband is missing, whatever. It's like, do you do your skincare routine? I'm like, well, I would just swipe on a Koji Fab really fast and then I would continue on.
Get something,
Oh my gosh.
Like a daily cleansing pad. Okay, so what about, I can't remember the name of it, but there's a collagen stimulating product instead of filler.
Oh, yes,
right?
Sculptra.
Okay.
Yeah.
Tell me about that. And then didn't you get that around your belly button?
Yes.
Okay, so I know people using this like in their face.
Yep.
But then there's also, I guess you can do it there.
Body.
So
yes.
Elaborate.
Sculptra is all the craze right now. It's actually been around for a really long time. However, in the last year or so, it's been relaunched by Galderma, and we've perfected the technique and the way we mix it and all these different things. So it's kind of been reborn. And so we are absolutely loving it here. We keep saying we're obsessed with it. But there's a lot of different uses for Sculptra. So what it is, it's a biostimulatory. So it's not your traditional filler. So when you're thinking of the HA fillers that we use, like Restylane or Juvederm, where we can fill the lips or the cheeks and things like that, those are gels that are made from hyaluronic acid. Sculptra is completely different. Think of it more as like a medication, and the saline that we inject it with is just the carrier. So if you use Sculptra, for example, in the face or in the skin, it's injected and it goes in and tells your body to make its own collagen. So it stimulates your own collagen growth. And what's beautiful about it is it looks so natural. It's your own collagen. So it's a natural collagen builder. It's great for anybody who wants a very natural approach. It's great for, I have a lot of fitness people who are wonderful candidates for this, because just your overall really lean patient who doesn't have any fat in the face and almost needs just like a pan facial volume treatment, where it's like we don't want to use all of this filler. Sculptra is really beautiful, and it goes in and it builds facial volume. And then it can also be used as a skin booster. And so that's what I'm doing with my stomach. We can inject it into the skin where you have a little bit of laxity. So for me, after having 3 babies, the twins, the area around my belly button, that skin's just deflated and kind of lax. So we inject it into the skin, and it stimulates collagen growth, and it strengthens that skin back up. So it will tighten that skin a little bit. And again, these are just great alternatives. Like, I don't want to do anything surgical, so there's really nothing else to do. Sculptra is an amazing option, and I'm noticing a ton of improvement even just after the first treatment.
Oh, nice.
Yeah.
How many would you typically do?
So it's going to be anywhere from 1 to 3 to 4 at the most, really just depending upon, you know, how far you want to take it. So even after 1, I saw improvement. After my second, which I just finished, I'm seeing more improvement. I'll probably do it 1 more time, and I'll be really happy. Mm-hmm. We can also use it in cellulite dimples to kind of smooth those out. Nice. We can also use it to build the booty, so the BBL. Mm-hmm. And so for that, we need a lot of it. But if you have a really flat booty and you want to build some volume, you can actually use Sculptra to build a little bit of volume. And, you know, with this stuff, some of these women, like, they're working so hard, they're working out, they're doing everything they can, but they just need a little booster. So that's where this stuff comes into play. So yeah, it's great to have these options that just really help people, if there's a certain thing that's bothering them, to have a solution to help them feel better about themselves. So Sculptra is really amazing. Temples on the face, I love it for temples. It's one of those areas that really shows age. Mm-hmm. And it's not an area where people come in, they're, you know, just banging their door, I'm here for my temples, you know, but when I do an assessment and I show them, you know, if they're getting really that concavity, we call it that little peanut shape, that really shows age. So if you feel like you're kind of sinking in there, we have a fat pad that runs up, and just through chewing over time, we kind of eat away at this fat pad over the temple, and as that atrophies and we get more of that concavity, we can use Sculptra to fill it up a little bit. And it's so subtle. No one's going to know you have your temples filled, but it just gives you that little youthful appearance that just age backwards.
Yeah, because I feel like that might, to put actual filler there, might be like a lot, you know, because
that
would be like, whoa. Like you said, especially for people who have a leaner face, whether that's from training or just otherwise, sometimes like filler can be like a lot, you know, and then it's like, then you start to get that like filler face, which of course is a injector problem also, like if you're just doing too much.
Yes.
But on people who are really lean, you're probably going to be able to see that like so extreme. So you would just put that anywhere that you basically would have filler, right? Like, so temple, cheek, jaw.
Yeah.
But not like lip, right? Because
no, we don't do
that's not
sculptra
really-
near the eyes or the lips. More just in those larger areas. If you're starting to just kind of feel like you're getting a lot of laxity, we can treat the preauricular space, which is in front of the ear, the temples, and then of course we can take it all over the body. So it's just great for those larger areas, and again, a very natural, beautiful way to just build volume. So you're super lean people who are just hollowed out. If you see people who have the really sunken cheeks, if you can see. Yeah. It's great for that, fanning it over that area. It's just going to help build the volume.
And how long would that last? So obviously filler typically is what, like 12 months, 18 months?
Yeah, filler's going to be like 12, 18, 24 months, depending on what we use. Sculptra's much longer, so 3 to 5 years.
Oh, okay. Well, that's also exciting.
Yeah,
that's really good to know, because everything, like, I feel like, especially with like Botox, right? You're like, oh my God, this is amazing. And then you're like, I need it again.
Yes.
I need more.
Yes. Low maintenance.
Okay, so Sculptra. I was like, what is the name of that stuff? But that is super interesting. So if anybody, because I've talked to a few friends who have gotten that, and it was like, yeah, it's this alternative. And I was like, but is that like legit? Like, you never know. Yes. Because people, we've talked about this before, like the threading, right? Like that was like a huge thing for a while. And you were like, it doesn't really, like, it's really popular, but it doesn't necessarily mean that it's going to work.
Exactly.
Yeah. I don't really feel like I see that as much anymore. People kind of like stop that trend.
I don't think it got really hot for a minute, and I do have some colleagues that use them, but I'm just still not a fan of threads. I mean, they work, but they don't last.
Kind of what I got from it. Like, it's going to work immediately.
It's going to work, and then it just doesn't last, and then you have a suture in your face, and I always think of things like, would I do or want that in my face? And with threads, the answer is no, so I'm not going to offer that to my patients.
Yeah. There's another thing I've seen, and like, obviously when you do like any kind of like self massage, like, I understand that can like stimulate blood flow and like reduce puffiness, but I've seen videos where basically people are saying like, oh, you can like change the shape of your face by like massaging a certain way. And I'm like, I'm just not sure. And I feel like really excessive massaging and pulling and tugging, like, wouldn't that be a bad thing?
Totally.
Yeah. Like, they're talking about this is like, oh, this is like a Botox alternative.
Yeah.
And then I'm like, but you're literally like, I feel like you're probably creating more laxity in your skin. Yes,
it's not good to torque on your skin like that. Yeah, I mean, some
people... Do you know what I'm talking about?
Like, is it like those little gua sha and jade
but then some people
tools?
Do it with their hands, but it's like a technique.
Yes.
And I'm like...
No, that would be false. You cannot truly sculpt your face that way. I'm glad that... Yeah, no, you can't do that.
Yeah, no, people say crazy stuff online, so like we know that, but maybe a little bit, right? Like a little bit of rolling, a little
lymphatic drainage is real. I mean,
yes.
That's true, and that's why some people you'll feel like things ebb and flow with water retention. Mm-hmm. So if you've had Mexican and margaritas and your rings are tight, it's likely that your under eyes are a little puffy that day. So anytime you do feel like you need to depuff a little bit, you can take one of your great serums or oils, and you can do a very gentle massage and you're always moving things away from the eye into the perimeter of the face, and kind of help with a little bit of lymphatic drainage or water retention. But that would be a very gentle sweep, and again, the point of that would be to move fluids away, but you can't permanently like hold up muscle or tack skin that way.
Yeah, I kept seeing that for a while, and I was like, all right, I really need to clear this up, because
that's the one thing I hate, that people advertise or false advertising or smoke and mirrors and things like that, because it does confuse our patients, and it's hard for people to realize what's real and what's not. And I think that's where it helps to really find a provider that you can go to and be like, is this real? Can this help? Someone who always has your best interest at heart.
Yeah, and like we were talking about, like filler face, right? Like somebody who's going to say, no, you don't need this. Or that's why whenever I come here, like, what do you think I need?
Yeah.
Because I trust you fully. Like, I am not going to say like, and even if I did, if I was like, hey, I want all this, you would probably be like, oh, let's not do that.
Yeah.
Right? But some people are not going to. It's just like any kind of surgeon, you could go say, hey, I want 800cc implants, and you're like a petite person. Like, that's probably going to bottom out. Like, that's not going to be a good situation. But there's some surgeons who will be like, sure, we'll do it.
Yeah, and those people are, obviously not in it for the right reasons. And so finding somebody who truly cares about their patients, wants them to feel and look amazing, and is not afraid to say no, is a big deal.
Yeah, that goes for everything in our industry.
Yeah.
Like, same thing with coaching, same thing with it. Like, hearing no is frustrating as the consumer, as the potential client, but oftentimes there will be those situations where then somebody will come back like months later and be like, thank you, like that's actually what I needed to hear. I didn't want to hear it then. Totally. But now 3 months later, I realize, oh, okay, no, I actually like that was what I needed. And like now I'm in that headspace to move forward.
And that patient or that client, those are usually the ones that will stick with you long term because they realize, oh, this person, they care about me.
Yeah. Oh my gosh, no way. Like we actually care about our patients
and
our clients. So another question, speaking of filler, I know there is multiple different types of filler. What would you say, like what differentiates what type of filler that you use, and if somebody's looking to get this, like what questions should they be asking? And obviously, does it depend on, the location, all those types of things?
No, that's a great question. So first and foremost, you want to make sure you do your research and you go to a reputable provider and that they're using FDA-approved products. That seems like an obvious one,
I'm like,
but there is actually, I just made news. There was a medical spa at Kansas City that the owners just went to jail. They were using some kind of like aftermarket parts from Amazon or Canada or something like that, injecting non-approved injectables into people's faces. And so that is just so scary. So that's first and foremost. Always make sure that you're going somewhere that you trust and you do your homework. And then when it comes to, so with that said, when you find someone you trust, they should be able to do that part of the work for you. I think it's always good to be an educated patient. Like I always tell my patients what I'm using, where I'm using it, and why, because I want them to know. So if someone says what products in your lips, they can tell you. But I don't want them to be burdened or have to worry about that. I will direct them and tell them what they need and what their options are, what's the best choice for them. So a good provider is going to know what you should be doing and help guide you. But to break it down, there's two of the largest injectable companies out there. Allergan, they make Botox, they make your Juvederm portfolio. And then you have Galderma, they make Dysport, and they make your Restylane portfolio. And so within the Juvederm family and the Restylane family, there's, I can't even think now, 6 to 8 to 10 of those products in each family. And that's where it gets confusing for people. They're like, do I need Restylane? Do I need Juvederm? There's Ultra Plus, Ultra, Voluma, Velour, Velux. Like, which one? Those are going to differ based on what we call their rheology. And the rheology is kind of like the science behind the gel of the filler. And so they all differ basically in their particle size, how thin or how thick is the filler, their hydrophilicity, how much water does that particular product pull into it. Because if we're using a product near the eye, we want a low hydrophilicity. We don't want something that's going to draw a bunch of water up by your eye. However, in the lip, we want that because we want the little plumpness. So there's that. There's longevity. How long do we want it to last? And then it just depends on the part of the face. So certain fillers are going to look better in areas where there's more or less tissue, more or less volume. So that's where it comes down to the patient and just looking at their actual anatomy. Like, are you starting out with cheeks? Do you have no cheeks? Are you really hollow under your eyes? Are your lips non-existent? What are we working with? So we kind of take in all of those different variables, and then we hone in on, okay, we could do this one or this one, and this is what I'm going to choose for that particular patient. So the pricing will differ a little bit between some of the shorter or longer duration products, but yeah, there's a whole science to it. So don't let that overwhelm you. A good provider knows how to do all that in just a quick minute and will basically lay out your options for you. But it is great to know that there are different options. And at the end of it, all of those gels are made of hyaluronic acid, which is a naturally occurring carbohydrate in the body, and they're all completely reversible. So that's one of the things you should always ask your injector. They should have hyaluronidase on hand at all times, which is the antidote, the enzyme that dissolves the filler. That way, in the event you ever have an issue, a complaint, a concern, a complication, you can dissolve the filler immediately.
Yeah. And that's something, too, that typically, like, if you start, I feel like with the lips, even if you have a great provider, I think that sometimes, like, if you just do it for a long time, like, you have to dissolve it at some point and restart. Would you say that happens to, like, what percentage of patients?
I do feel like, the longer we're using these products and seeing them, we know that filler just lasts longer than we even think it does. And so, especially with lips is where I see the most migration. I always explain to patients, at the end of the day, your lips really are little compartments, and you can only fit so much filler in them. So when we push the limits, eventually that filler's got to go somewhere. And so that's where people will start, it'll start coming out of the lip, and you'll see a little migration. It's almost like a little mustache of filler above the lip. In some patients, it's so mild, they don't even really realize it's happened until I point it out. I'm like, you've got a little migration. I really think we should dissolve your lips before we refill them, just so they look their best. So it happens over the years, and there's not any one reason. It can happen from poor technique. I've certainly seen it where somebody comes in and they've just had a botched job, and the injection technique was clearly not good technique, and it's outside the lip, and it was their first time, and so then we just erase and we start over. That's another conversation. That's my don't group on your face conversation. Because then you have to pay for the dissolvent and then pay to get them redone. So then you've just, but
anytime I hear that somebody is like, oh, I got a deal at this place, I'm immediately like, don't go there. Like, please. That doesn't seem like a good idea.
Super discounted pricing means discounted results often, so.
Because you're paying for not just the product, you're paying for the injector.
Yes.
Right? Like, it's not like, oh, hey, I got this on Amazon for $20 instead of $30 at Target. Like, that's not what we're talking about. Like, the product is the product.
Yep.
You are paying for the experience of the individual.
Absolutely. And that's the big thing. The products just are expensive, so that's just how they are. But then also you have to think a good provider spends thousands and thousands of dollars on continuing education and learning and classes and conferences, and is always getting better for their patients. And then you have supplies, and you have overhead, and you have the rent of the building and the alcohol pads, and so it just adds up, and so if you're getting it for super cheap, you should be weary, because there's a reason for that.
Anytime something is like very cheap like that when it comes to service,
mm-hmm.
I'm always like, okay, run.
Yeah.
And when you do dissolve the lips, would you say that like everything comes out when you dissolve, and it's like basically starting from scratch?
So that's going to be a little bit patient dependent. So if it's just like the lips just aren't looking good anymore, if there's a ton of migration, a lot of times I will be like, let's just start with a clean slate. Let's dissolve everything and start over. So in that case, we put the dissolvent in, and it takes about 3 to 5 days to fully work. And then we want to wait like another week or two just to let the lips heal any kind of inflammation, and then restart. So it's, usually a 2 to 3 appointment process, and we wait like 2 weeks before completely refilling. And then there's times when there's just a little tweaking that needs to be done, and overall they look great. There's maybe just some very minor migration, and then we'll just do a little bit of dissolving. We'll maybe feather some above the lip, get some of that older filler out, maybe take them down just a little bit, but not completely wipe them out, and then we'll refill. So it could go either way.
Okay, well, that's good to know. I thought it was like everything's going.
No, you don't have to. You can definitely
like, this is sad, because like I feel like a lot of times the bottom doesn't really migrate as much.
No, you're right.
So then you're like, oh, well, then you take all that away.
Yeah. And some of it truly is just over the years, the muscle that runs around the lips, the orbicularis, or just it's a sphincter muscle. So the pursing, chewing, talking, everything, that muscle can just kind of push filler outside of the lip. And that can just happen slowly over time.
Yeah, that makes sense. Okay, pivot a little bit. Training with makeup. So a lot of people who listen to this podcast are going to be into training, whether that's lifting, cardio classes, whatever it is. And, right now we're like in the thick of summer, and even if it's cold out, like you're still probably going to sweat at some point. So training with makeup, what are your recommendations there? Obviously the recommendation is not to do it, right? Like the ideal recommendation would be train with a completely clean face. But if you do have to train with makeup, or you want to train with makeup, what would your recommendations be?
I would say, obviously, if at all possible, you want to cleanse your skin before you train, so that when you are sweating and your pores are kind of opening up, that you're not getting any bacteria in there. And then if you do train with makeup on, like if you are in the middle of your workday and you want to get a quick workout in, my suggestion would be to do something where you don't perspirate a ton, because the major sweating and the wiping of your face, I think, is what can really cause bacteria to spread and things like that, and even just like touching your face. So try not to touch your face. Like if you need to dab sweat, I would keep a clean towel with you and like use the towel to dab any sweat, and make sure you are changing that towel in your gym bag, because some people might keep the same towel in there. So,
like,
use
what is this towel
a clean, dry
God.
towel to kind of gently pat at the face and try to keep your actual fingers off of the face. And then if you are, I'm assuming if you're training in makeup, you might try to touch that makeup up afterwards. So that's again where I would say make sure your makeup brushes are clean, so now you're not introducing like dirty brushes on the face, because I think that's what it's going to come down to if you're sweating and your pores are opening up and then you're introducing bacteria or kind of clogging the pores if makeup's getting in there. So the less you sweat, probably the better. And then whenever you can wash your face off, then you just hit it hard and get crazy sweaty.
I know, it's so frustrating because like I sweat a lot, but there's some days where like you're either doing something and then you go train, or you just want to put on makeup, and like if I want to film something or whatever, and like you just, I don't know, some days you just like wearing makeup.
Yeah.
And but I know it's awful. Like,
one thing I'll do is we have like an awesome tinted, we call it our Prime and Protect SPF with like a great tinted glow. So because I know that you just sometimes want a little coverage when you're at the gym or you're working out and you just want to feel good. So something like that would be a better option than makeup. And just keeping your makeup lighter. Like if you are somebody who wants to work out and still kind of look good, maybe do the mascara on your brows, maybe even a little eyeshadow, but try to keep the base makeup on the lighter side. That would be helpful too.
Yeah. But so say you do want to train in the morning. Sometimes when I want to train in the morning, but then I don't want to do my morning skincare and then train and then do it again, right?
Yeah.
So what would you recommend in that sense? Like you wake up and you are going to go train. What do you do, your full morning routine then, or do you do that after you train?
What I do, because I work out first thing in the morning, I'll wake up and just work out. I don't do anything. I don't even cleanse, because I've just done my whole night routine before bed. I've cleaned, I've used my pads, everything. So then I just wake up. First thing I'm doing is going downstairs and getting my workout on. And then when I come up, I cleanse my skin and do my whole skincare routine. But if you did wake up and say you felt sticky or sweaty, or you just wanted to clean off your skin, you could do like a nice gentle cleanse. And then I would probably just do a toner and then go work out and finish the rest later. I wouldn't really put lotions or anything like that on if you're going to go sweat.
Yeah, that's what I always wonder. And I'm like, wait, now I feel like I just put this on. And then there's like, because I typically won't, if I train in the morning, I still have like a little bit of time, right? Like I'll maybe like an hour or so when I'm doing like maybe a little bit of work or like my morning routine stuff.
Yeah.
So sometimes I'll just do that. And then I'm like, oh wait, I just put all this stuff on and now I have to go work out. Like this is so silly.
You can double dip though. It won't hurt anything.
Yeah.
We have a really good, okay, my two products that I love for my fitness people are daily balancing pads.
Yes.
Those are bomb.
Game changer.
Yes. They're
Total game
salicylic
changer.
wipes. And those are just great to swipe on right after you work out. It's going to kill bacteria, tighten up pores, and just clean your skin. Those are great. Also, our refreshing toner is amazing too, and it's a spritz, which I love. So you can spritz that on. That would be something you could do right when you wake up if you just want something to be a little bit refreshing. And again, it's going to clean the skin. It has the salicylic in there, just kind of something you can spritz on right after you work out. So either or both of those are great just to keep in the gym bag after a workout.
Yeah, no, those pads are so helpful. And like I started noticing a lot more breakouts again during the summer. And I'm like, I haven't changed really anything, and I was like, honestly, I'm just sweating a lot more.
Yeah.
And it's just inevitable, with where we live and just training and being in a hot environment. And typically a lot of the places that I travel are very humid as well. So it's like, I couldn't get away from it. So like doing that on a daily basis has helped so much. I mean, of course I still get breakouts, but within reason now.
Yes.
It's much better.
No, absolutely.
So those pads are really great, and they're very affordable. Like
They are.
obviously the acid pads are more expensive because there's a lot of high quality product in there. But these are definitely like a daily, like affordable pad.
Yeah. And you can use them once or twice a day. They really last.
And they don't overly dry.
They're not. They're not overly drying.
Because like that's, I feel like the big issue with that kind of stuff is that it's like, oh, this is dry, but now I'm like flaking.
Even our teens love those. That's a great pad for the breaking out teen. They're great.
I'm like trying to think back. What did I think I used like the St. Ives like
Apricot scrub. Yeah.
Like, what was Teen Life?
Clear and Clean and Clear. Remember that? Like astringent.
Oh my gosh. Yeah, it was like that orange
Yes.
color. Oh my god. That, and then like the Maybelline like Dream Matte Mousse makeup. You're like, what is this stuff?
I know.
Like,
I know. It's
so,
comical now, but
so bad.
I always loved all of that stuff, which is why I love
course.
what I do, because I was always that kid like wanting to go to Walgreens and look at the aisle at all the different Sally Hansen perfume. Who knows what I was doing.
I love makeup. I used to wear blue eyeshadow. Like, I was always like just wild.
Same.
So thankfully, and even now, like looking back, maybe like, I don't know, 5, 6, 7 years ago, like just how dark I used to do makeup. Like, and that was kind of the look. Like,
Yes,
especially like
the smoky eyes, and yes.
Yeah, but it was like a heavy smoke.
I think I had like black.
Yeah.
Yeah,
oh, for sure.
From MAC.
Yes. Always. And not like I like smoked out the eyelid. No. Like, it was
Same. I think I needed a lesson or two.
we thought we were killing it. Okay, so we are recording this in August, but we're going to start to transition out of summer and into more of the colder months. I guess unless you live where I live, but even then it still is just a different temperature. So
Yeah.
What are some things transitioning, because now everybody's so probably used to their summer skincare.
Yep.
What are some things to start to look forward to or to change for the fall and winter?
I think the biggest thing is hydration. So in the summer, a lot of times we lighten up. We use serums as hydrators instead of lotions, or we rely on solely our tinted SPF, or just our SPF as kind of our daily moisture. And then moving into the fall, into the winter, we're going to see the air is drier, the skin is getting more dry, less sweat, like you said. So introducing more hydration. So that's where maybe we're adding in lotion in addition to your serum. And so it's okay to layer. So if you're using a serum hydrator and it's not enough, then you want to add in a lotion. If you're using just SPF as your moisturizer, you probably want to add a serum or a lotion during the day. So we want to keep the barrier of the skin intact. And so when we get super dry or flaky, we get broken down, we get over exfoliated, then we put our exfoliating products on and we're peeling. It's just like a vicious cycle. So listening to your skin, and as you get drier, giving your skin the hydration that it needs, that would be the biggest thing moving into winter. And then sometimes moving into fall or winter, as you do get drier, sometimes that also means cutting back a little bit on your exfoliants. So if you're using pads or retinols or things like that, you might need to slow down the rate at which you're using those so that you're not getting too dry. You just have to listen to your skin. And definitely through the different seasons or different times of the year, you're going to change your routine just a little bit. So that's where, we can help too. If people are experiencing changes in their skins, new breakouts, or sometimes it is seasonal and we need to actually change products too.
Yeah, like I notice when I come up here for, whether it's like the fall event that we do, or especially when I come up for the banquet, which is always usually in January.
Yeah.
And it's like immediate. It's like literally that day, my skin is just like so dry.
Yeah.
And it is so interesting because it's very like there's not a lot of humidity, but it's also really cold, so it's like both of those things together. And then I just get off the plane and within a few hours, my skin is just like,
yes,
flaking off. So I have to know like, okay, I need to probably apply moisturizer, like, or bring a heavier one. Cause a lot of times when I travel, I don't really bring a heavy one.
Yeah.
Because I'm like, what if it blows up?
I
bring like the cheapy stuff when I travel. But then for that, it's like, no. Like,
no,
if
I know.
I'm going somewhere cold, like we are bringing the thick moisturizer.
It's true. And the other thing I'll have people do with the seasons is change their weekly treatments. So for a lot of people, that's masks, and masks are really popular right now, and everybody loves a good mask. So maybe in the summer, if you're using more of like a skin tightening or exfoliating mask, in the winter, I would use something super soothing and hydrating. So we have like more repair, restorative type masks, and just sleeping in those or masking in those every once in a while, just anything to like nourish the skin. That's nice with the season too.
Yeah, that's good. And I'm not sure when this will come out, but it'll be coming out. Like this podcast will be coming out like as the season is changing.
Yes.
So I was like, I want to ask about that.
It'll be a good time to reevaluate your skin plan.
Yes, reevaluate your skin plan. And last question, what is something that you've either reintroduced to the practice or something that you're just really excited about that, you've been wanting to share more with people? Like, hey, we started adding this here, or this is my new favorite product. I know you really have been liking sculptra.
Yeah, I've been loving. I would say what's new would be we have sculptra or even microneedling with sculptra, which is cool on the body. So that's been really cool.
Interesting.
It's again just for like that laxity. Arms are a big one where people just feel like their arms are, the skin is a little looser or crepey. We can needle with sculptra there. And then on our aesthetic side, we just bought all new LED panels for every room. So with the facials, we're doing a lot of LED light therapy, both red and blue. We're doing our V-beam, our laser treatment on the legs for vessels and veins. We were doing that just on the face before. So we're really just trying to stay, we're finding that perfect balance of staying cutting edge. So we always want to be in the know and able to offer our patients the latest and greatest. But also, we don't want to be the super early adapters where we just jump on everything that hits the market, because in this field, it's ever evolving. There's something new every single day. And quite honestly, a lot of things are smoke and mirrors. So we only want to offer things that truly work, truly give real results, and that we've vetted. We watch what our colleagues get and use, and just really do a lot of research. So we bring the best, but also we study it really hard and make sure we love it and it's amazing before we bring things in. One of the things that was really popular this week that I loved, it cracked me up, is the Moxie that you just had done. I don't know if you saw this, but Kim Kardashian had it done last week. And so it was just all the buzz. Everyone's like, oh my gosh, if Moxie's good enough for Kim, it's good enough for me. But
so funny.
We were cracking up because, all right, Kim, we've been doing Moxie over here for the last 6 months. Where have you been?
You're like the hipster. Like, I heard this band first, and now they're popular. I always feel like you have to like say that with certain things.
So true.
But no, that was an amazing treatment. Like I said, I made a whole reel on that and like a follow-up video, and it was really, really great. And like within, the first few days were definitely a little bit, dry, and wasn't wearing makeup, wasn't really sweating, all of that. But outside of that, there wasn't really a lot of downtime. Like I've seen some peels where like you see people and you're like, oh my goodness, like that was not that. Like I was just like, hey, I'm not going to go out of my way to go do things. Also, that was after like I'd had 2 back-to-back travel weeks and like Summer Smash, and I was just like, this is my like cue to like chill.
Yeah, I think I kind of sprung it on you. I'm like, and we're doing Moxie today, and you're like, wait, what's that?
I was like, oh, okay, sure. But it was amazing, and I honestly like I noticed a really, really big difference afterwards. So
yeah, it's a cool laser because it's so transformative. It works on texture, pores, pigment, kind of does it all. And the downtime is so little. So, it used to be when you do a laser treatment, you have all this crazy downtime and people just don't have that. So it's cool to have a great laser with little downtime. So that's been really cool too.
And I'm sure there's some that are like, it's warranted, right? Like if you have certain things like, hey, this downtime is warranted because this laser is going to be best for whatever. But I didn't have anything that was like so outstandingly terrible. It was more just kind of like that overall, like you said, like tightness, brightness, texture, and it really did help with that. So
yeah, just a great little glow up for anybody. But overall, I would say our big thing that we're trying to drive home here is just everything is customized and individualized. So it's not a cookie cutter approach. So when people come in, we really just want to help them look and feel their best. And nothing is transactional. We want it to be the skin journey. So we're giving you the option so that like these are things we can do today, here are things we can do in 6 months, in a year, just things that kind of planting the seed that you can do over the long haul to just help your skin age gracefully so you can feel amazing. And that's really the approach we want to take, so that we have all the tools. We have so many different amazing treatments, and not everything is right for everybody. So we just bring them in, we look at their skin, we help them map out and plan out different ways to anti-age and just feel amazing. And that's really the big thing we're trying to do.
Yeah, and it's amazing here. So if you're in St. Louis or you want to travel, cannot recommend coming here enough. And then how can they find out more about your skincare line and everything else you guys offer?
Yes, we have obviously good old Insta. So our practice is Racquel_aesthetics. Our skincare is RFA Skincare. And then our website really has a little bit about everything, and that is RacquelAesthetics.com. And my name has a C in it, RACQUEL.
Yeah, I was like, wait, yeah, it does.
Yeah.
Racquel Aesthetics. So we'll put all that in the show notes so you guys can check it out. For any other information about our coaching services and products that we offer, you can visit our website, teamlocofit.com, and we'll talk to you guys next week.